Thank you very much, sir. With honor and pride, I would like to introduce our guest of honor, Dr. Saurabh Dixit, sir. He completed his undergraduate studies from North Bengal Medical College and Hospital, and he was an honors holder in the cumulative record. He did his master's as MS General Surgery from the Institute of Postgraduation and Medical and Research, SSKM, Kolkata. He is a fellow of International College of Robotic Surgeon. He has done a fellowship in minimal access surgery. He is the chairman and the CEO of Highland Care Clinic in Dwarka, Delhi. He is the director at Global Academy of Medical Education, which is very much known to students known as GAME. He is a former surgical faculty and the country head at DAMS, Delhi. And at present, he is a surgical faculty and the head country head of surgical discipline and an academy. With this pleasure and pride, we would like to invite on stage Dr. Saurabh Dixit, sir, for his talk.
Hello. Good afternoon, everyone. So, it's a pleasure moment for me to be a part of you people because every day I'm seeing critical cases and handling the critical patients. But talking to the young medicos of the country is a real pleasure about. And that too at a beautiful location of Sikkim Manipal. That's, first of all, I am just feeling something like you people are blessed with. So such a wonderful college, and take my words, like I did it from North Bengal Medical College. I know the condition of that college. But anyways, I love my college because this has given a lot of things to me. And this college is really fantastic as far as the landscape is concerned, as far as the departments are concerned, and as far as the team is concerned. So I extend my thanks to sir to allow me to speak. So let me tell you about myself, why I chose surgery. It was not a nightmare, it was not a mere decision making just because my rank came into that time frame where I decided to go for surgery. It was a motivation from the MBBS days. What I want to tell to you, what I want to share with you is that this is the most crucial time of your life. Do you know, this is the time when you have friends. This is a time when you have enemies also. You know, enemies. Because there may be a group, yes, you are familiar with it, you're friendly. There may be a group you're not talking to. Take my words, the more you go up, you'll be left alone. Leave friends, you will want enemies and they will not be there. So try to understand, enjoy this phase. This phase is not going to come again. Make these 5.5 years memorable. Extract as much as you can from your team, from your seniors, from the professors, because they are there for you. You know, when I was in your shoes, I used to have a different mindset. And now when I am into the teaching, I have a different mindset. A teacher always thinks one thing, that what should I teach my students, that his career gets a boost. We always keep on thinking, you might be thinking that, okay, sometimes my professor, my senior, they're a bit rude to me, they're angry on me. It's not like that. They never keep anything inside. They have one greed only, to make you a successful, good, humble doctor. And that is why sometimes they have to change their ways. Now, I want to tell you one very important thing, that the decision making for your careers, they start at this level only. Properly attend the clinics. All the clinical postings you should be going for. Try to learn from each and every patient. You know, each and every patient teaches you. Like, I have done more than 20,000 laparoscopic surgeries. 20,000. That's a big number. Big number. But still I'm into a phase of learning. Recently I was doing a cholecystectomy and I found that there are 2 cystic ducts and 2 cystic arteries which we generally don't get to see. So that again taught me a variation which I never saw. So let me tell you, you are dealing with a mysterious science, and that is human science. You cannot intercept one's brain, what is inside, how can you intercept a body? Every body has different thing for you. So try to learn each and every day. Let me tell you, once you go out of this college, you'll be acknowledged as a doctor. But no one will give you chance to learn again. Like in this phase, you might feel like, okay, I don't know this, you'll go to your sir and ask, sir, teach me this. You'll go to your different professors, sir, teach me this concept. But try to understand, once you enter into the medical field, whom will you ask? If you ask, people say this doctor is not knowing anything. So this is the time when you should try to utilize it. Now let me tell you something about the branch of surgery and how the medical careers are changing nowadays. You know, like if you talk about me as a surgeon, so I was a die-hard fan of surgery, and that is why I used to attend a lot of, you can say, clinical postings. Even, let me tell you about my internship. There are a lot of people who don't like doing emergencies. So I used to exchange someone's short, like suppose my short subject is going in internship and I'm posted in ophthalmology. So I used to exchange it with someone who was not willing to do the surgery emergency. And this is how people used to think that, okay, I told him, he will be giving 12 hours in the night. But actually, that was the hard work, that was the investment I was doing into that branch. And that investment is paying me heavily in terms of everything, in terms of reputation, that you people have called me to talk to you, in terms of financial gains, and in terms of confidence. Because I have been doing it for a lot of times, and it is not a new scenario for me. Let me tell you, when you are in a medical college, you are protected. You have a team. You have your college who's protecting you. Once you go into the private sector, one single case wrong, you're thrown out of the market. Today, the level of understanding which the patients used to have for the doctors is not there. Try to understand, you have to prepare for the coming India. You have to be prepared for a better version of India. And for that, you need to embrace this change. And the change is that you have to be clinically sound. And this is the place from where you can be. When we talk about surgery, there are a lot of students. Can I have a hands up? How many of you want to become a surgeon? Yeah. So in this class, only 15-20%. And if I ask how many of you want to join pediatrics or MD medicine, can I have a hand? There are a lot of people. Yeah, lot of people. You know why? Answer is exposure. The answer is exposure. When you want to see a case in pediatrics, or when you want to see a case in medicine, you'll ask the senior, take your permission and say, sir, can we take the history, can we do the clinical examination? You get. They are very happy that a student wants to learn, and they allow. You know why they allow? They allow, sir, so that you develop that attitude, that love for that branch, and they want to see you as your mate, as your, you can say, as your colleague in the coming days. But imagine you going to a senior and asking him to do a cholecystectomy. Sir, can I take this patient and do a gallbladder? Or, sir, can I take this patient, please, sir, and can I do appendicectomy? Yep, this is not. Surgery is more of a, you can say, more refined branch, and a branch which requires a lot of, a branch that requires a lot of precision. You're handling life. In medicine, if you prescribe a wrong medicine, 10% chances that the patient might die. Otherwise, there might be short reactions, and over the time, the patient is okay. Of course, patient will have a, you can say, may have a audio altercation with you, doctor, you did this, you did that. But in surgery, once you make the incision, you cannot say, no. I want to make one more. You know, this is a branch where decision making is very important. And that comes with the discipline. And who teaches you discipline? Your MBBS days teaches you discipline. You have to learn the importance of time. Like yesterday, I landed at 3 or 3:30 in Bagdogra, and I came to this place around 9:30, and I was so tired because in morning again I had done a surgery, and then I came to this place. And at 1:30, I got a call from my hospital that there's a patient of intestinal perforation. Doctor, are you available for the surgery? At 1:30. And my phone was not silent. And you know, from 1:30 to 3 o'clock in the morning, I kept on arranging, talking to my friends. When someone would come and operate, I could have easily denied that I'm not there, you arrange for someone else. This is the level of responsibility and care you have to get in yourself, and then only you will become a doctor. You need to understand that a sleep for 5 minutes could change the hierarchy of their family. Yeah? A patient might die, and that is why learn the ethics. And how can you learn those ethics? Right at this time. You have your postings. You people miss your postings. And this is the wrong thing. You know, NMC has come up with a change in need pattern. They're saying that now, next will be there. And now you people keep on calling me, asking me, texting me, sir, how the new change is going to happen? Actually, it is you people who are asking this question. We don't need an answer. We don't need any answer. Why? Because, tell me, a cholecystitis will remain cholecystitis even you attempt NEET or you attempt NEXT. Are you getting my words? A case of congenital diaphragmatic hernia will remain the same. So again, one very important request, that concentrate on your MBBS curriculum. This curriculum is beautifully designed to make you competent for every exam or any exam you want to attempt in. As far as surgery is concerned, give yourself the maximum exposure. Don't just get infatuated by watching Kabir Singh ki nahi yaar, surgery leni hai bhai. Surgery leni hai, bullet pehle kharidni hai, pehle ladki ko mani hai, uske baad orthopedics leni hai, this and that. But this is not that branch that has been portrayed in the media. You know, surgeons live, I'm telling the grim truth, the surgeons live 5 to 10 years lesser than their counterparts. At age of 30, I became diabetic. And you know, first time when I was operating on a patient, it was 4:30 in the morning, and the patient was in diabetic, was a known diabetic, so they were seeing their blood sugar. I said, let me check my fasting also, and it was 496 that time. What do you think? I eat a lot of sweets? Yeah, by looking at me, you can say. But it is not. It is the stress. Doing 20,000 surgeries in this short career takes a lot of toll on your health. So you need to be physically fit, mentally stable, and decided that you want to become a surgeon. I'm not saying that you should not be taking this branch, because this branch is the branch which is most flamboyant of all. I may be wearing this suit, but I find myself not looking that handsome in this suit, because for me, scrubs are the most handsome, you can say, clothing that I can have. You know, coming out of OT, showing a thumbs up, that everything is fine. You know, you can only feel that sense of pleasure when you become a surgeon. Take my words, you watch any movie, you do anything, you will not get that fun. You'll get that real excitement when in the middle of the night a patient came with appendicular perforation and you did appendicectomy or maybe a right hemicolectomy, and next day you're talking to patient, how are you feeling? And patient is saying, yes, I'm feeling good. Then the relatives, you know, they're looking at you with a, you can say, you can only feel that gesture. So students, let me tell you, don't run away from this branch. It's a beautiful branch. There's a change in mindset now. But there are a lot of factors responsible for this change in mindset. I'll talk about that also, but there's a change in mindset. Rank 1, if you talk, what are you going to opt for? They say MD radio diagnosis. I'm not against radio diagnosis or MD dermatology. You know why? Because you don't want to enter into that fuss. Patient handling emergencies. And you may be competent enough to handle these two things. The third is, if something goes wrong, how will you handle the patient? And their relatives and their goons. They'll break your car. They'll break the OT. He'll break open your skull. And this is why many of you are trying to run away from this path. But this is not good. But someone has to lead the path. Now you must be thinking that it's too early for me to talk about this, that what branch I will be taking. No, it's not too early. This is actually the right time. You have to attend all the clinical postings with all the diligence. You should ask more and more questions to your professor. I have seen a lot of you complaining that, sir, this subject is not taught good. Do you know, they're the one who have been doing this job for 20, 30, 40 years. You cannot even match the level of knowledge they have. You are not interested. They will not hold your collar and pull you out of the crowd and say, no, you have to study this. You will have to go to your professors and request, sir, please teach me this. And mind it, they will be overwhelmed to teach you. You fear that, okay, if I go to my professor again, he will know my face and then in exam. Aisa nahi hota. We are more than, you can say, overwhelmed to see a student who is working hard for that branch. And as far as surgery is concerned, it's a pleasure for us that you come to the OT. The only problem we have is that whenever you come in a mob. 20 people coming, wearing all the scrubs, all the slippers, and then when the actual head of department comes or the consultant surgeon comes, he's asking, sister, where is the dress? And then you see the OT flock with 20, 30 medical students. And then we ask anyone who wants to scrub, and then we are more than happy to see someone opting out. Do you know why? Because we need one of you to hold that retractor. This is the reality. Whenever you go to OT and you ask, and they ask you, someone wants to scrub, and what do you think? They will give you a scalpel and ask you to do a gastrectomy? No. They want someone to hold the retractor. And then your friends feel that, oh my God, iska to cut gaya. 2 घंटे 3 घंटे वो रिट्रैक्टर पकड़ के रखेगा, उसे डांट पड़ेगी बार बार, नहीं की करछो, सही से पकड़ो इसको. And try to understand. After that, again, if you are ready to hold the retractor, you have that thing that you want to be a surgeon. You know, I have been holding the retractor at least for hundreds of surgeries. I was more than overwhelmed to hold that retractor. Do you know why? I felt that I was a part of that team who successfully treated that patient. And that is where you get to know that this is my cup of tea. You know, suppose if you are interested in gynae and obs, you go to the labor room. Don't look at the dirty aspect that there is a lot of, you can fill the material here and there. See the beautiful product that is created out of that branch. That's a human life. You'll fall in love. I've seen a lot of doctors saying, no, I don't want to go into that gynae and obs. You can ask her, every time there is a, you can say, case, they get the first call. Sir, please come. And you know, handling that newborn for the first time, that's again a pleasure you can only feel. You cannot even explain. Sir, am I right? The resuscitation, when you see that baby's abdomen is low, and you quickly shift that patient for level 1 or level 2 or level 3 nursery, and then after 10, 15, 20 days, when the baby is getting discharged, you know, you'll understand this feel when you become parents, that this is what they want at every cost. And you are the one who actually did it for them. So, Bache, this branch or this medical profession is a wonderful profession. Don't look at the grave aspects that, oh my God, there are a lot of fights going on, people come and hit you. Keep on doing your good work. Ultimately, do you know there's a balance between good and evil? And the day the evil will go up, everything will shatter down. So if this word is being sustained, still have a belief that good is more than evil. So don't stop treating the patient. Don't run away. And let me tell you, like nowadays, students have a notion that I want to go into this stream, I want to go into this stream right from the day one. And that is why you start preparing with the MCQs. This is again the worst thing that you are doing. That is why NMC came with a change. They want the clinical aspect out of you, not the MCQ aspect out of you. You know, you study one concept, suppose you study nephrotic syndrome, and if you understand that nephrotic syndrome, you may have 20 MCQs framed in 200 permutation combinations you will be able to solve. But if you remember only 20 MCQs, you will not be able to understand the topic. So what are you gaining at the end of the day? You are gaining nothing. You are failing in your exams also, and you are failing in the entrance also. So yes, preparation for entrance is important, but it should be a smart study, smart work. And the only way, let me tell you, like being a head of Global Academy of Medical Education, what I have noticed, like my student in our institution, we have a student mentor whose rank is rank 3 to rank 8. And let me tell you, all these single digit rank holders, they have done it in internship. Their internship completed later, they gave exam before. And they were all dedicated interns. And that is what I want to tell you, don't skip from your duties. Don't change the culture. Don't listen to anyone who says that clinical postings are not important. Let me study and listen to a lecture and do the MCQs. But clinical postings are very important. Do attend your clinical posting, then correlate the things. You know, if I have to frame a question, I'll frame a question. A patient presented to me in the ER room with pain in the abdomen. That patient is having a long-standing history of peptic ulcer disease. And when I went for an X-ray, there was a gas under the diaphragm. What are the options? ABCD. But go retrospective. If you have seen a case of peptic ulcer disease, the moment you listen to this word and that patient came to ER, there was a history of peptic ulcer and there is a gas under the right diaphragm. You will not even think of reading the other options. You will say, where is this peptic perforation? I think this is the diagnosis, and you will find it. So this way, you should strengthen your preparations. But as far as surgery is concerned, don't run away from it. Give yourself a proper time. Try to scrub in as many procedures as possible. Then only you will understand that yes, this is your branch or this is not your branch. Those who have raised their hand, I wish them all the best luck. But before joining, do experience this branch. Do go to the surgery postings. Do scrub in OTs. Because then only you realize that you want to be a surgeon or no. Because let me tell you, if you are passionate about surgery, sky is the limit. No one can stop you. The initial, there is one thing which is known as a plateau phase. Like I still remember a time when I passed out and I was in dire need of work. So I used to get call from small nursing homes, sir, you can come to do a lap cholecystectomy. And they used to pay me 2,000, 3,000, not more than that. And 2,000, 3,000 amount was not sufficient even to run a family. Because you will not get a lot of cases. A new surgeon, koi nahi karana chahta hai surgery. You know, no one wants to risk. You may be handsome, you may be technically very smart, you may have lot of gold medals. No one wants. They want an experienced surgeon. Because when it comes to life, no one wants to take the risk. So they used to say, sir, practice ho jayegi, aa jao. Practice ho jayegi, aa jao. And I still remember the time when I got 500 rupees. Now you must be thinking, ki 500 rupees ka calculation kaisa hai? You know, in government, in private hospitals, we have package for the surgery. So there was a patient whose package was 45,000. And then next day when I had to discharge the patient, I asked the patient, how are you feeling? Patient said, sir, thoda sa dard ho raha hai. मैंने कहा रुक जाओ, तुम आज रुक जाओ, कल जाना. You know, when I asked for the payout of that patient after 1 week, they gave me 500 rupees. I said, why these 500? Okay, the doctor, you asked the patient to stay. And that is why you should bear it from your pocket. So this is the grueling initial phase that you might have to practice. But do you know, don't think about that 500. I made a lot of connections with those 200, 2,000, 5,000 rupees. And these patients acknowledge me for my work. And recently, you know, I charged 1,75,000 for a lap cholecystectomy. Imagine it is beyond the scope. Even when we talk about Delhi, the best hospitals like PL Kapoor, they also charge 1,15,000. A patient came to me, I said this is a critical case because the patient has been denied the surgery from a lot of hospitals because the patient was having COPD, and in COPD, when we do a laparoscopic surgery, we use the gas that is CO2. So that might cause an arrest. And everyone said that this patient will die after the surgery. I said, I'll take 1,50,75,000. I'll do that surgery. And I've done it. Recently, I uploaded that surgery also 6 minutes 30 seconds. I did that surgery, and the patient has been discharged. So this is what I want to tell you. That had I got myself depressed during that phase when I used to get 2,000 rupees or 500 rupees, I would have never been standing here in this podium. I would have committed a suicide. So I want to tell that don't run behind money. Like the thought process of this Generation Z, I would call you people Generation Z only, you're the youngest of all, is like you're thinking which branch is lucrative in terms of money. No. Think which branch is lucrative in terms of your satisfaction. If you're satisfied with a branch like biochemistry, it's more than anything. So, money is never the quotient of happiness. It is the job satisfaction that you have. Like when I will be dying, I know that I will be dying in my scrubs. I know I'll not be regretting that phase that I wanted to be a surgeon, I couldn't be. Similarly for yourself, each one of you should give these 5.5 years to explore something out of you. Try to understand what you want. And you can only understand what you want if you spend these 5 years very, very, very meticulously. Listen to your professors, they're always right. We have a dictum in hostel, no? Senior is always right, accept it. But why you don't follow it for the professors? They're always right. They always want you to come out. It's a pleasure for, like recently, one of my students, I gave him letter of recommendation. He came for laparoscopic training at my institution. So I gave him a letter of recommendation and he has been selected in John Hopkins. My letter going to John Hopkins, and they have selected him for for a fellowship. I couldn't go to John Hopkins at my time, but he did that. And that is the pleasure that I got. Had I been envied, I would have never given him a letter. I would have laughed that this MBBS student is asking for a letter of recommendation for surgery. And we professors, we doctors appreciate that you have that guts to come up. And that is why that MBBS final year kid got an observership in John Hopkins. And that impact that he will have now, it's going to be charismatic. So I want to tell you that this is the most tender phase of your life. Utilize it smartly. Study the maximum you can. Don't miss any clinical postings. Do whatever you want, but the first priority should be your profession. And your profession will teach you everything with the time. Don't think what is going to be the financial outcome, because many of you think that MBBS, फिर 3 साल, फिर उसके बाद 3 साल सुपर स्पेशलिटी और उसके बाद पता नहीं क्या होगा. But during COVID, when everything was stopped, these people, I'm talking about the general public who has a notion that doctors are getting a flamboyant salary and they are getting paid heavily and they're not doing their work. Even those people who used to hate us, they came with folded hand that he is the only person who can save my family now. So when you do MBBS, you have already attained a minimum level of social security in terms of respect. वो बात अलग है कि when we go back to our home, our relatives keep on asking, भाई डॉक्टर बनेंगे? कौन से डॉक्टर बने? And they hand you a MRI report. इसको देख के बता दो क्या है. So that is, don't take that part. Take everything as a challenge. Study well. This is a wonderful branch. And take my word, still 70% of the crowd has a faith, has a respect for doctors. When you will write this term DR for the first time, when you'll pass your final year, you'll that day feel the gravity. And you know, I don't fight for anything. But if I go to a place and my doctor is not written in front of my name, I talk to them for this. And you know, this is not a tag which I have bought. I have earned this after 15 years or 10 years of hard work. So please add that. And you should be confidently demanding for that. Because like you people, I was also on that side and I have done it. Everyone will do it. So take my words, I'll not take much of your time. You people are the one who can shape this country's future. We have a huge potential. You know, 80% of you get infatuated by the West and you go out. I have also got lot of good offers. Like very good in terms of financials, but still I have not gone. Do you know why? Someone has to take that responsibility. These professors who are sitting for you, they're not sitting here for the, you can say, for the sake of money and the job. That's the second thing. A person who is there in the medical college, do you know, when a doctor joins medical college, his aim is clear that I want to show the path to my juniors. So I think this is reality. When you go to the private practice now, you're only a commercial figure. You're doing your job, you're coming out, you're getting paid for that. I salute to all the doctors, all the professors who have given their life in these medical colleges. Because if they are not there, then people like me will also not be there. And that is why I also have taken that charge that I will also spread this level of wisdom with my kids, and that is why I keep on training. You see, in my hospitals, a lot of students like you people come, and I never say no. A pre-final year, a first year, a second year student comes to my hospital and says, "Sir, I want to see a total laparoscopic hysterectomy." I say, scrub in the OT. Be a part of the team, and then only you will concentrate on the skin. Then only you will concentrate on the screen, that what is going on. So don't stay away, don't go away from the clinicals. They're very essential. So that was a very short, you can say, conversation, but I just love this. At the end, I would say you people are a lovely audience, and just take my word that you people are doing great. Just continue doing this. Don't stop. Whatever be the hurdles, just continue to serve the humanity. Because if we stop, the earth will also stop. We know the earth is rotating. Why earth is rotating? Because it is the dynamics of human life. Everything is continuing. It is continuous. If you stop working, if we stop treating patients, everything will come to a halt. And try to become a figure, not that your name is there in Forbes, but do something that even after your death, people acknowledge you that he was the one who actually taught me this thing. And that is why I am competent enough to stand in front of the society. So thank you everyone. It was nice talking to you people. And I hope that now you people will be more attentive and more alert towards your clinical postings. Do make the maximum use of this opportunity, because this time is not going to come. Thank you everyone. Thank you. Okay, I was willing to ask this also. Any questions of your? Anyone wants to ask a question? I would love to answer those questions in regards with the profession, in regards with the branch, how to approach the things. Tell me, I will tell you. Just feel free. I'm just like you people. I'm not a special figure. I'm just very ordinary person like you people. You can ask any of your doubts. No one has a question? Yeah, someone wants to ask for that side. Yeah. I would love to answer your questions, because the questions that you will ask, you'll ask your real-time scenario-based question. How will I come to your age group and ask and get to know what problems you are facing? Are you shy of asking questions? Okay, he wants to ask.
Sir, what are the prospects of robotic surgery?
Robotic surgery is a very blooming branch. When we talk about surgery, nowadays the surgeries are becoming more and more precise. So earlier we used to do a laparotomy, and then we went for a minimal access surgery. So when we talk about minimal access surgery, we're making small holes and going via instruments and doing the surgery. You know what is the biggest challenge? Like, you are seeing me, I'm a 3D figure. Okay? But when you see something you see me on screen, I look a 3D, but I am not 3D. I'm a 2-dimension. So your hands-on movement, when you talk about minimal access surgery, they're very difficult. It looks that, okay, let me hold the artery, but it is very difficult to hold that artery because actually the depth perception is the skill that you acquire. In robotics, you have a 3D vision just like the open surgery. The second is, you have the degree of motion, like your hand can rotate, pronate or supinate only. But in robotics, the robotic arm can have a multiple rotation, so suturing becomes very easy. So nowadays, all the urological surgeries, like if you talk about prostatectomies or radical cystectomies, and gynecological surgeries like total laparoscopic hysterectomy, where a lot of laparoscopic suturing is required, there's a big advantage of robotics. So robotics, as per overall scenario, if you see, the prospects are good, but in country like India, where a lot of things are not covered in insurance companies, it's still on the, you can say, process of evolution. The learning curve in robotic surgery is less than the conventional laparoscopic surgery. So actually it is a robot assisted surgery. It's not a proper robot is doing the surgery. You are the master and robot is the slave. So the precision is one very big, you can say, advantage. But yes, the things are still on the verge of improvement. Maybe by the time you people come up, maybe after 8 to 10 years, all these insurance companies might be bearing the cost of robotics, and then it will have a boom like it is having in US, not in UK, because in UK everything is covered under the NMC, National Medical, you can say, bill they have. So their cost is more important. That is why robotics has not flourished that much in those Commonwealth countries, but in US, where everything is privatized, there, yes, definitely it is booming. So we follow the American standards in any way. So maybe by the time you people come to this branch, yes, you'll have a good scope. Thank you. Any more questions? You can ask. Anyone wants to ask any question?